Okay, it's Mari McInerney from Croakey here, and I'm with Vivian Lin, whose birthday it is, I believe. Happy birthday.
Thank you.
We're at the International Medical Regulation Conference in Melbourne, and you're from the World Health Organization,
Yes.
Western Pacific region. Could you just let me know what your title and role are?
Yes, I'm the Director of Health Systems in the Western Pacific Regional Office of the WHO, which means we have responsibility for 37 countries and areas. And it's the biggest country as well as the smallest island in the world.
You
And
kept hinting that, actually. What is the smallest island in the world?
Well, the smallest area that we have is actually a UK jurisdiction, and it's the Picants.
Well, we know them well here.
Yes.
Now, you've just been, I wanted to speak to you about two things, if we could, at the conference. One is that you've been in the days leading up to the conference, you've been involved in the Western Pacific meetings. And then at the beginning today, you outlined some of the issues, supply and demand issues, you said, in healthcare, health systems and regulation for those regions. Could you go through them?
Yes, of course. Of course, our most important objective is to make sure that we can achieve universal health coverage in all countries. And that means people having access to quality services without undue financial hardship. How do you get quality? You need, in the first instance, a regulatory system that can assure safety. So this is the importance of regulation. Now, we have countries that are in very different stages of economic development, very different frameworks for public administration. So we have some places that really have still old colonial laws that haven't been updated in a long time, and other countries that are in transition, just starting to develop a regulatory framework. So they're very, very different. And of course, the cultural dimensions as well as the political dimensions shape the way regulations evolve. So when we look at our health systems, we have systems that are often dominated by the hospital, very limited primary care, very little connection between them. People end up at the hospitals because there's no general practice, but countries are talking about developing general practice, talking about developing family medicine. These are important developments, but the financial drivers are also a little bit problematic. When governments are not investing and there isn't a properly developed health insurance system, then what we see is doctors and hospitals who are overcharging, oversupplying services to the detriment of the health of the patients and the community. However, on the demand side, we also have communities that are very respectful of authority, who don't necessarily speak up about their dissatisfaction until they feel truly aggrieved. So this is also a problem about how do we actually develop a system so that people can resolve conflicts as early as possible rather than resorting to medical violence.
Because you said that there are actually rising levels of violence. How does that manifest?
Well,
and where?
We do have doctors who are killed. This is well reported in the media, and we see this in some of our transitional countries, like China and Vietnam. We've seen these instances, and what we need is a system that really can ensure safety and quality and address these problems before they actually emerge.
Now, your region must cover some very varied nations and developments in regulation. Can you sort of give a broad brush of, what's happening in some of the bigger ones and what's happening in the smaller?
Well, it's not so much size that's the important thing as it is probably some of the traditions. So what we have in the former British countries that were formerly under British administration is probably a similar set of institutions in terms of professional councils, medical boards, nursing boards, but in some places it's still very, very strongly dominated by the profession and very little accountability, if you will, to the broader public or even to government, perhaps much more on the old traditional self-regulation model. In other instances, it's very much just government run. where professionalism has really yet to develop because it's not really within the traditional culture of some
Can you
of these
say what
countries.
places would be examples of that?
So I think if we look at the East Asian countries, where there's a strong tradition of Confucianism, yes, there is a sense of self-cultivation that's important, and self-cultivation is something that contributes to a good family and therefore to a good society. On the other hand, there isn't a sense of a professional identity, a sense of ethical practice that is a responsibility of the individual practitioner. So that would be one of the ways in which it's different, and so it's really very much up to the government to be able to state the kind of behavioral norms that are expected.
Now that was, I guess, the topic of the plenary session that you chaired here, and you you went into it saying that we do need to have stronger, adequately resourced regulatory authorities in the Western Pacific area, and one of your examples was China. Can you just detail that one, and then perhaps go into what the bigger session tried to look at?
Yes. One of the really fascinating things that came out in our policy roundtable discussion is a recognition that for a country the size of China, where there are 8 million health workers, at the national level, there's only 3 people in the Ministry of Health, which is called the National Health and Family Planning Commission, who have responsibility for the policy in this area, which is absolutely extraordinary. Now, of course, it's a decentralized country, and there are 31 provinces and regions, and each is the size of equivalent country, but there would only be 3 people in each of those provinces as well. So having regulators that are actually really well resourced is pretty fundamental to being able to really implement. Of course, there are different ways you can go about implementing, but to have people who can actually lead and champion this area of work is terribly important.
And what was your sense then that came out at the global discussion? There were people from, panellists from Korea, from Uganda, from, help me, UK, and the US and Australia. Yeah. So what were the major issues that came out for you in terms of regulation for those challenges, and what they're doing well?
Well, look, I think the issue of strengthening a regulatory framework is true everywhere, but also regulation isn't just about hitting people over the head. Regulation is about it's about protecting the public. It's about giving assurances to the public that the system is functioning properly, and it also protects the medical profession from perhaps some of the less savory behavior that occasionally happens. So regulation has multiple functions, but regulation has to go hand in hand with education. And education has to be, of course, appropriate to the resources available, but education has to assure, in the first instance, a level of competence so people have safe healthcare, but also it's about improving the quality of healthcare. So regulators and educators very much need to work together. I think that's true everywhere. Despite differences across the countries, there are very similar shared challenges. It's just a matter of degree.
And resources.
And the resources, but there are ways in which we can learn the lessons from each other. And I think that's the other very important thing to recognize, is that forums such as IAMRA and the World Federation of Medical Education do allow for the sharing of resources, about the regulation both at the individual level, but also about the functions and the positioning of these boards and the role that they play in society.
And just a final question, and you've touched on it a little bit, talking about the Confucian values, but it was a really interesting discussion, as you said. I think to one of the questions, there could have been a whole plenary on it, but about cultural values informing non-Western regulation. What's your takeaway from that?
Well, I think, again, if we go back to the supply side and the demand side, we see some of the differences. When you get to a more Confucian culture, you're less likely to have individuals who will make complaints. And fundamentally, in the kind of regulatory model that we see in Australia and many of the English-speaking high-income country, there's a reliance essentially with individuals expressing their voice and a free media that actually brings attention to issues. When we go to some of our Asian countries, people are less likely to complain, and also there may not be a free media to allow the expression of concerns so easily. So this is one of the big differences about, how do we actually work with these differences. But similarly, I think where we do not have the profession as a strong social institution, then how do we inculcate a sense of professionalism? I think is the other challenge and a difference we see.
And that led, there was a discussion around traditional medicine. Some that support it, some that's not. But I think, was it you who pointed to the fact that in Australia that the accreditation of Chinese medicine was the first to take place, or in Victoria, first to take place outside of China. Where do you see, what's the agenda there?
Well, I think if you look at traditional medicine, and it's something that came up actually throughout the conference quite a lot, there is a question of why would we regulate and how do we regulate? If we understand regulation to be protecting public health and safety, then when people are using it widely, then, and if the profession isn't capable about regulating itself, then the government has a very strong role to protect the community. In the first instance, if you can set a basic standard, at least people are safe. So you weed out the people who are poor practitioners, who are not real practitioners, who really should not be inflicting themselves upon patients and the community at large. And then I think it's a question of how do you then develop that profession, the evidence base for it, practicing appropriate to context. And I think this is where I think with the experience in Victoria of now some 15 years, but in Australia since the national scheme brought Chinese medicine into the national scheme, we can also see really the development of a strong common standard across the country. And that's certainly absolutely important in the Australian context because people are using Chinese medicine, if not other complementary forms of healthcare.
And going out of here, what would you like to see happen as a matter of priority from the whole conference?
Well, I think one of the very positive things about this conference is the fact that it's actually happening in this region. Of course, the regulatory systems are more developed in the higher income countries and in the English-speaking countries. I think what we've been able to do is both bring more of our Asian and Pacific countries to this conference, and that helps them look at how they can adapt the lessons and develop their own systems. But I think it's also really important for people to make no assumptions that there is only one approach. And by understanding the diversity of history and culture, political systems, all the regulators can learn and be more reflective about why some things work in some places and why don't they work in other places. So I think that kind of mutual learning is very important.
Thank you very much, Vivian.
Pleasure.